Radio Health Journal. I'm Nancy Benson. This week, tonsil stones, a little problem that causes a big stink.
I just operated on a 46-year-old for tonsil stones, so they can come at any time.
We'll find out why such a little problem is such a big thing when Radio Health Journal returns.
I'm Reed Pence, the producer and host of Radio Health Journal. If you like listening to Radio Health Journal, you'll also like our sister show, Viewpoints, which covers a wide array of topics from education to history to the environment. Here's a preview of what they're covering this week on Viewpoints.
This week on Viewpoints.
I don't think sex really matters. If you're interested in the field, I always say, try and get one of those ancillary jobs. Become a CNA, become a phlebotomist.
Male nurses aren't just employed to fill a quota. Their role is vital to overall patient care. Then,
I would hope he would still be alive,
What happens when the bully you wished would go away actually did? I'm Marty Peterson.
And I'm Gary Price. These stories in depth on your public affairs magazine, Viewpoints.
Listen to Radio Health Journal and Viewpoints on your favorite radio station, and subscribe and listen anytime on Apple Podcasts, Google Play, and Spotify. Also, follow us on Instagram and Twitter at Radio Health Journal.
Most people don't think about their tonsils until they have a problem with them, and that doesn't happen as often as it used to. In recent decades, the number of tonsillectomies performed in the United States has declined. More people are keeping their tonsils through adulthood, and that's a good thing. According to Dr. Alter Peerless, an otolaryngologist at Mercy Health in Cincinnati, tonsils are an important part of the immune system.
The tonsils are lymphoid tissue, the same tissue that is found in lymph nodes that we all have in our neck and our groin and under our arms. And the job of lymphoid tissue is to filter out infection. In the throat, the tonsils are in the back of the throat. What we normally think of tonsils are what are called the pharyngeal tonsils. There is, in addition, tonsil tissue on the back of the tongue and tonsil tissue behind the nose, and those are called adenoids.
When the tonsils work to keep infection out, they can sometimes become infected themselves. Before the widespread use of antibiotics, tonsil removal was often the answer to stop recurrent strep infections there. But while more people have their tonsils these days, that means they're more susceptible to developing what are called tonsil stones, hard, light-colored lumps that look just like they sound, as if a person has pebbles growing in the nooks and crannies of the tonsils.
Tonsil stones occur because the tonsils, like everything else in the body, is lined with skin. Because tonsils are lymph tissue and are supposed to filter out bacteria and virus that we breathe in, they have grooves in them that we call tonsil crypts. The tonsil crypts are lined with skin just like every place else in the body, and like every place else in the body that is lined with skin, the skin sheds. Every time we shower or wash our hands, we shed skin. And shed skin in some of these tonsil crypts will form tonsil stones.
But it isn't just dead skin that can get caught in tonsil crevices to create stones.
Tonsil stones are from food and cells and bacteria that collect in the pits on the tonsil surface. Over time, that debris hardens and forms into a stone.
That's Dr. Lauren Boehm, assistant professor of otolaryngology at the University of Michigan. She says tonsil stones are rarely harmful, but they are unpleasant. They're often smelly, and it's disconcerting to have visible white or yellow flecks in the back of the throat. Tonsil stones can range in size from smaller than a grain of rice to the size of a large grape. Peerless says the stones form to fit the shape and grooves of a person's tonsils, so some people are simply prone to develop tonsil stones through no fault of their own.
There's really nothing that predisposes to it except the anatomy of the tonsils. Patients have tonsil stones because their tonsils happen to have crypts in them, happen to have particularly deep crypts.
However, that means tonsil stones are unpredictable. There's really no one group that gets them more than others.
I would say that I see them in my practice every week. They're quite common. Honestly, I see them in all ages. I just operated on a 46-year-old for tonsil stones, so they can come at any time.
Most of the time, tonsil stones are just an annoyance, not a major medical concern. They don't keep the tonsils from performing their function in the immune system. But Bohm says they do have some very unpleasant symptoms.
One of the most common symptoms is bad breath. People can also develop a sore throat with some discomfort in the area of the stone. Alternatively, some people actually feel pain in their ear as opposed to their throat because of shared nerve pathways. If you look in the mirror, you may notice white or yellow debris on the surface of the tonsils. The tonsils themselves may become swollen or cause difficulties swallowing.
With those symptoms, it's no wonder people are unnerved by them and are motivated to perform some behaviors that can help prevent them.
We know that good dental hygiene with regular brushing and flossing can help prevent tonsil stones.
Good oral hygiene, and by that I mean gargling frequently with either mouthwash or salt water, would probably be helpful.
However, sometimes there's not much a patient can do to stop tonsil stone development. Fortunately, they can be removed.
Sometimes tonsil stones become dislodged on their own. Other times, particularly if they're causing discomfort, they can be removed. Typically, we would recommend having it done at a doctor's office. Usually that can be performed using some local numbing medicine. If it were to be performed at home, we recommend not using anything sharp to avoid any injury to the throat area.
Peerless says some people dislodge tonsil stones themselves using a Q-tip, but that's not recommended. If they recur over and over again, he says an otolaryngologist can perform a procedure to keep them from coming back.
If the tonsil stone is coming from one particular crypt, just one area of the tonsil, I will sometimes try as an office procedure to cauterize, to use either an electrical or a chemical cautery agent to close that crypt down and make it smaller and less prone to collect the tissue that forms stones.
Bohm says some patients have tonsil stones that are so troublesome and recurring that virtually nothing works. That's when Bohm will suggest making recurrence impossible with a tonsillectomy.
It's usually an individualized decision that is made between you and your physician. We oftentimes will weigh factors like degree of symptoms, reduced quality of life, and time away from school or work.
Tonsil stones produce medical problems and pain only occasionally, but carry an enormous ick factor with their smelly breath and disturbing visual. So tonsil stones often produce more of a response than their size and medical significance might suggest. You can find out more about all our guests on our website, radiohealthjournal.org. Our writer-producer this week is Morgan Kelly. Our studio producer is Jason Dickey. I'm Nancy Benson.
Radio Health Journal returns in just a moment.
Today's consumers are choosing foods for specific health benefits. Heart health tops the list, according to a recent study conducted by the International Food Information Council. Certain whole foods, such as grapes, which contain over 1,600 natural plant compounds, may be the key. Registered dietitian Courtney Romano is the health advisor for the California Table Grape Commission.
A heart-healthy diet is rich in whole plant-based foods. A first step is to consume more vegetables and fruit, including grapes. Fresh grapes have hundreds of naturally occurring beneficial plant compounds, including antioxidants and other polyphenols. Research suggests that adding grapes to the diet every day helps support heart health in both men and women.
Heart-healthy grapes from California are in season from May through January. Grapes of all colors, red, green, and black, are a natural source of beneficial antioxidants and other polyphenols, which contribute to heart health. Visit grapesfromcalifornia.com for more information.
Paid non-attorney spokesperson paid for by the Sentinel Group. Attention military vets and current soldiers who served between 2002 to 2016. Have you or a loved one suffered hearing loss or tinnitus after serving or while serving in the U.S. Armed Forces? You may be entitled to compensation. 3M, the manufacturer of earplugs made for combat, recently paid the government $9.1 million to settle a False Claims Act case for knowingly selling these defective earplugs for over a decade. Specifically, the United States argued that the manufacturer knew their earplugs were too short for proper insertion insertion into users' ears and that the earplugs could loosen and therefore didn't perform properly or reduce noise the way they should have. If you or a loved one suffered hearing loss or tinnitus after serving or while serving in the U.S. Armed Forces, you need to choose the right legal team that has the experience, support staff, and resources to seek the most compensation for your injuries. Call the Sentinel Group now for more information and a free case review. Call 800-655-6458. 800-655-6458. That's 800-655-6458.
What are you going to do with your old car? You can try selling it, you could junk it, or you can donate it to Heritage for the Blind. Your car will be towed away for free and your donation is tax deductible. Just call 1-800-835-1478. Heritage for the Blind accepts cars, vans, trucks, and boats. It doesn't matter if your vehicle runs or not. It will be towed away for free, and you'll be supporting those that need help. Heritage for the Blind is a nonprofit organization that helps the visually impaired live fuller lives. Call right now to donate your car, and as a special thank you, you'll receive a free 3-day vacation voucher to over 50 locations. Call Heritage for the Blind right now. Call 1-800-835-1478. Donating is easy, and your vehicle is towed away for free. Plus, you'll get a free vacation voucher for donating. Call now, 1-800-835-1478. That's 1-800-835-1478.
Thank you for listening to Radio Health Journal, a production of MediaTrax Communications. If you enjoyed this broadcast, please support our show by subscribing, sharing it with a friend, and leaving a review on Apple Podcasts. You can find more Radio Health Journal stories about health, science, and technology on Apple Podcasts, Google Play, Spotify, and RadioHealthJournal.net. Also, follow us on Instagram and Twitter at Radio Health Journal.
Coming up next week on Radio Health Journal.
If you just sit there, there's a higher likelihood that you're going to be shot and potentially killed.
Run, hide, or fight. New thinking on the best way to survive an active shooter.
Then today's new college students are facing more stress than ever. Some experts say they're not ready for it.
They're less able to handle difficult emotions and disappointment because they've been coddled, a lot of them. They're the generation of you get a trophy just for showing up.
All that and more on Radio Health Journal.